Well, hey everybody. Hope your Super Sim went well, or you're getting ready to do your Super Sim, or it's completely over now and you are at home, probably nervous and fretting about patient assessment for tomorrow on Thursday. Just wanted to make a follow-up video on patient assessment. So remember, the setting is family practice. You have 30 minutes to do a focused H&P on an orthopedic complaint. Okay, so 30 minutes is going to go by fast, but remember, before you walk in the room, there's going to be a face sheet. That face sheet's going to have the patient's name, date of birth, meds, allergies, family history, past medical history, social history, vital signs, and their chief complaint. Okay, so that'll already be on the face sheet. You'll have a clipboard, and on the clipboard is the standard form that you guys use, so you can, do your history and everything. And the vitals are actually going to be printed on there for you. So you're going to go in the room, okay? So even before you walk in the room, based on the patient's chief complaint of shoulder, neck, back, knee, whatever it happens to be, you should already have 2 or 3 differential diagnoses in your mind before you even walk in the room. So you're going to walk in the room, okay? You're going to introduce yourself like normal. You're going to confirm the name, date of birth, why they're coming in. You're going to do your old carts, okay? On the ortho complaint, okay? And then you're going to want to do your review of systems. And basically for ortho, okay, it's going to be general. And then in addition to general, you're going to have musculoskeletal, neurovascular, and skin. And that's enough for ROS that you need to do. You should do at least 3 questions for each system, okay? And then don't forget to confirm the accuracy of the meds and the allergies and the past medical history since their last office visit. Easily done by, are you on any new medications or any new allergies since your last visit that maybe you forgot to mention to the nursing staff, okay? Any new hospitalizations or surgery since the last time? And they say no, you're done, okay? So then I want you to verbalize the review of the vital signs like we always do, okay? And then you're going to start by looking, right? So that's the first thing you do. You're going to visually inspect whatever the area of chief complaint is. And so you have to verbalize. Remember, I talked about that in class. Make sure you verbalize everything. I'm looking for asymmetry, swelling, edema, rash, whatever the case may be, okay? So after you do that, the next thing you're going to do, I'm looking at the rubric here, so palpate, okay? So you want to palpate where on the joint, but also palpate the unaffected side. So not only are you checking the affected side, you want to check the unaffected side. Then you're going to do neurovascular status. Okay, so remember, you haven't had neuro yet, so this is just a brief thing. So if it's a wrist complaint, okay, can you feel me touching you down here? Neuro's done, okay? Check cap refill, make sure that the cap refill is fine. There's your vascular, check pulse, good to go, okay? Not any more detailed than that. You want to check active range of motion, okay? So whatever joint or area it happens to be, you want to check for range of motion, okay? And then active. So if the patient can go through, if they can move everything around, actively, then you don't need to do passive, but I would still verbalize. The patient was able to fully move their extremity or whatever the case may be with active range of motion, thereby passive range of motion is not necessary, okay? Then you're going to assess strength, okay? So assess the strength of the muscles around the area of complaint. And then you want to check the unaffected side. So not only are you doing neurovascular on both sides, you're checking range of motion on both sides, you're checking strength on both sides, okay? And then you're going to do special tests on both sides, okay? You want to inspect the joint above and the joint below. Cursory. It's not a very detailed thing, okay? So if I hurt my elbow, can you do this with your wrist, okay? You do this with your other wrist, okay? Then that's, range of motion, okay? Check the strength and all that. But the joint above and the joint below is just very cursory. Don't spend a lot of time on it, okay? And then you're going to do your special tests, whatever special tests they happen to be. Do at least 3. And then, like I said in class, you And in the prior video, you need to know what all the special tests do. Although you're not technically being tested on all of them, you have to perform the test correctly in order to get the finding from your faculty. So then I would say, I'm now going to do a Maudsley's test, okay? And then you just walk the patient through, spread your fingers, put it on the table, resist, okay? And then the proctor will say, your Maudsley's test is positive or negative. You have to know what a positive and negative means, because that's going to help you explain to your patient what's going on or what you don't think is going on, and then also going to help you in your presentation because you need to know. Let's see here. So you're going to explain your diagnosis to your patient, and then you're going to explain 2 other potential diagnoses, or your differentials, and why you don't think it is. So I don't think you have Dequervain's tenosynovitis because your Finkelstein's test was negative. Okay, and I also considered, carpal tunnel, but your Fallon's test was negative, and you don't have numbness in your radial 3.5 digits or whatever it happens to be, okay? And then you want to order any imaging, okay? So the patient may or may not come with imaging. You may need to order imaging, so you can order imaging, and everything's going to be sent out, okay? So you want to send the patient out for an ultrasound, CT scan, whatever. You want to do that. And then you also want to, do your treatment options. What are your treatment options? Are you going to give them pain medication? Are you going to have them elevated? Do you don't want them weight bearing? You want their arm in a sling? You want to give them modified duty, depending on what they do for work, whatever the case may be. Okay, you want to do that. You want to give them whatever ER precautions that there may be. And then you want to set up a follow-up, okay? Are they going to follow up with you? They're going to follow up with Ortho? They're going to follow up with Room? Whatever the case may be, okay? And then from that, once you are done, you're going to take your sheet with you that has all your scribbled notes on it. Because remember, you have an oral presentation assignment that's due. Now, I've already printed the vital signs on that sheet for you. And then in the afternoon, I believe around 2 o'clock, Moodle will unhide the cases, and that'll have the face sheet that has all the patients, past medical history, social history, family history, because you're going to need that for your oral presentation assignment. Okay, the oral presentation assignment is a recorded video oral presentation, and so there's you guys have done presentations before, but you're going to need all that information to be able to do your presentation. Try to keep them, 8 minutes, no more than 8 minutes. You can re-record until you get it down. And like I said, that's not actually due until next week. So that way you can just go home and study for your exam. So other than that, follow-up, I don't know if I think I mentioned follow-up. So follow-up with you or the Ortho or Room or wherever the case may be. And then other than that, that's about it. So I'm hoping my 2 in-class demonstrations and the prior video and this video clarify any questions you may have, but certainly if you have any other ones, feel free to reach out to me. I'm going to have the optional drop-in office hours in C217. So that's the C building on the 2nd floor right by the elevator. So as soon as the elevator opens up, it's a classroom right across from there. So I'm going to be there between 1 and 3 p.m. and also available via Zoom with the link that I shared. And with that, we'll see you tomorrow.